If you don't know subluxation, you don't know chiropractic. There's so many people that go to chiropractors for years and years and years, have no understanding of why they're going, no understanding of what chiropractic does, what it doesn't do, think that chiropractic is the same as medicine or physiotherapy or osteopathy or acupuncture or massage. It's none of those things. Chiropractic is a very distinct science, a very distinct art, and a very distinct philosophy. And how chiropractic works is based upon a bone being out of alignment with the one above and below, reducing mental impulse, which is the impulses leaving the brain and going into the body, and nerve pressure or nerve energy as it leaves the spinal cord into the body. So, if in fact we have a bone that's significantly out of place, that it puts pressure on the nerves, then we have a definite chiropractic problem, and that's called a subluxation. Chiropractors do not treat symptoms of disease. Chiropractors correct subluxation. The only profession that does that, specifically taking one bone or two bones or three bones or four bones and moving them so that they can come back into their normal seat, their normal relationship, their normal position, getting the pressure off of the nerve. Now, let's think about this. Life. What is life by definition? Some people say, well, it's one damn thing after another. That's not what I'm talking about. Life is a force that moves matter. Matter is anything that occupies space and has weight. So when something moves, it's because life is doing it. So when I move my hands, you're seeing force and intelligence with matter. And so now you're seeing the expression of life. If they wouldn't move, you wouldn't see the expression of life. When you see somebody paralyzed, you don't see the expression of life. Even though they're still alive, you don't see the expression of life. And so life is a force that moves matter. Life is motion. Without motion, there's death. So the absence of motion would be the absence of life, which is the presence of death. So if we look at this, and we have a head up here, the brain is up here, and the extension of the brain is the spinal cord. And at this point where we have a bone out of place with one above and below, called a subluxation, at that point beneath the subluxation is paralysis. Now, what's the definition of paralysis? Just the opposite of motion. Paralysis, lysis is death. So we have death of a part or loss of motion. Loss of motion is reduction of life. So we have reduction of life from the subluxation, paralysis beneath that point. Above the point of subluxation, we have congestion. What happens there, as the electrical potential leaving the generator, the brain, comes down and transmits itself over the nerve, it hits resistance. When it hits resistance from the bone pressing on the spinal cord, then we have molecular formation up over the brain that causes sort of a magnetic field. That magnetic field disturbs the electrical potential of the brain, and we now have an aberrated individual, somebody who's sociologically off, somebody who's criminal in act, somebody who cannot think properly, who has an aberrated mind. This organ is dysfunctional. The brain is an organ just like the heart. It will dysfunction, and it's not suffering from lack of Prozac, I can tell you that it's suffering because there is something causing dysfunction of the brain as a result of a bone being out of alignment called subluxation. Now, if you look beneath the point of the subluxation, where there is paralysis, that would mean that we would have loss of motion. If we had loss of motion or paralysis to an organ, and we'll take the heart as an example, if we were to paralyze the heart, reduce the stroke volume of the heart, we'd have changes immediately in the blood pressure. We would have changes in the hydrostatic pressure, which is in the joints. So we would have pseudo-arthritic pain. We'd have swelling in the joints and pain. We'd have visual disturbances. We'd have changes in the ability to breathe because there would be swelling in the abdomen, or rise into the diaphragm, into the lung, so the lung can't take its full capacity of air. We'd have swelling in the ankles. We'd have a variety of symptoms. And you could be going to the medical doctor and say, oh, doctor, I have this, I've got arthritis, I've got swelling in the ankles, I've got chest pains, I can't breathe right, I'm not urinating right. He would say, well, take this pill, take that pill, this pill, those pills, and those pills. And ultimately, you'd be changing the chemistry of your body so much that perhaps you would even get even worse than you are already. And the problem was, not all of these things, they were effects. The effects of what? The effects of the body not working right. Why? Because there was a bone pressing on the brainstem or the spinal cord, causing dysfunction within the body. So, if you realize all of that and you look at the cell itself, the heart's made up of millions, if not billions, of cells. Those cells vibrate. In males, they vibrate 4,700,000 times a minute. In females, 4,500,000 times a minute. Vibrating so rapidly that your naked eye can't see them move. If you could look at your skin, you'd see them vibrating, but you can't see that. And the vibration is motion, and motion is life. And as we paralyze that and lose the vibration, As we slow down the motion of the cell, number one, cannot metabolize correctly, can't use foods correctly. It can't excrete its poisons correctly. It can't replicate normal cells properly. It can't reproduce properly. And so therefore we have the beginning of change or reorganization of the body called disease. Now, if we look at that tissue cell, a cell is made of molecules. Molecules do two things primarily. Of course, they cause adhesion, which makes us stick together, cohesion, which gives us the shape. So the cohesion and adhesion is a result of motion. If you reduce the motion, the molecules begin to separate. Separation of the molecule changes the structure of the tissue. If, in fact, you were to take a particular part of the body, and we'll take a woman's breast is composed primarily of fat and lymph, and all of a sudden in there we find red, yellow, or white fibrous material, or we find actually carcinoma material, then what's happened there? The change in the structure of matter because of the change in the molecular structure is called mutation. As soon as you say mutation, you associate it with cancer, but don't you see a lens that you once could see through of your eye, which is now opaque, and you call that cataract, was mutation of the cells that make up the lens. If you have skin that changes into psoriasis or eczema, you have mutation of squamous cells, which is mutation of the skin. If you have changes in the heart, where you have an invasion of fat into the heart tissue, or you have changes in the liver where it becomes cirrhosis or hardening, or you have changes in the kidneys where the capillaries can't function the way they once did because the capillaries actually are getting hard. Changing, mutating into something, reorganizing into something that isn't even part of your body. The whole body begins to reorganize. And you look at a case of AIDS, so-called. There's 14 million people, approximately 14 to 16 million people in the United States that have HIV, and yet there's only approximately 1 to 1.5 million people that actually have AIDS. What's the difference between the people that have the virus, so-called, that causes this thing called AIDS versus the people that don't have AIDS and yet have the virus? Namely, because their immune system is working properly. Their immune system is resisting. The host is not weakened to the environment. And you see, as long as this body is working the way it should and could, it has the ability to adapt to the environment, and survive the environment. And that's where the difference is between sick people and healthy people. Now, if you look at the reorganization of tissue, and you look at the mutation of tissue, you can understand that the whole physical body can change. And again, if you've seen pictures of people with cancer and or AIDS or any of these so-called diseases, you see their bodies looking one way, and then a year or two later you couldn't recognize it. The body has reorganized so badly that you say, it couldn't possibly be the same person. But it is. It's the same person with a different body. A body that's not physiologically normal, a body that's not healthy, a body that's reorganizing into something else, and eventually this life, this spirit of life is going to leave the physical body, and then we'll simply plant the physical body or cremate it or do whatever, because the body has no value without life. Without life, it's nothing. So it's important that you're concerned how much life is being expressed through this body. It's important to be concerned whether or not life is really getting from the brain, which is the center of life, into all parts of the body over the nerve system. So it's important if it's going through the conduit, which is the spine, whether that spine is lined up or not. Now, if we go beyond the molecule, then we're made up of atomic parts called atoms, and the atom has a nucleus. Around the nucleus are electrons spinning. And elementary physics says that if you increase or decrease the electrical charge of an atom, it'll blow its electrons. There is an electrical energy being generated for the brain that travels through your body. You are an electric person. You also have chemicals created, 60 million chemicals in this brain being able to be sent down through the body to the tissue cells. So we have little chemical messengers, we have electrical messengers, and we have infinite intelligence that created this body that dwells inside of this body. When in fact we change the electrical energy to an atom and it blows its electrons, it changes its atomic weight. So when that happens, then you realize that this whole physical body, from the bottom of your feet to the top of your head, is changing from the level of the atom up. That's serious stuff. You see, there's no pills to stop that. There's no cutting to stop that. That's because the body is not getting the message from the brain into the body, and that's because of a bone out of alignment called a subluxation. So the importance is that you understand what a subluxation is. The importance is that you understand what a subluxation does. And the importance is that you understand the relationship of subluxation to you as a being. And then it's important that you realize the association between subluxation and chiropractic, which is the mainstay or the principle of chiropractic, to locate and correct vertebral subluxations, maintain that correction long enough for the body to rebuild itself healthy, however long that may take. So I can say with absolute authority, and I can say without any thinking at all, that if you don't know subluxation, you don't know chiropractic. And yet if you realize, could you correct the subluxation in time before limitation of matter, before this body is closer to death than life, if you could correct that, then all of these changes, all of these molecular changes, all these tissue changes, and all of these electrical changes and chemical changes would come back towards normal, because the body always stretches to come back to its normal pattern, its normal genetic pattern. It wants to be there, but it can't be if it can't express life in its totality. So, as you go to the chiropractor, remember his or her job is to correct subluxations. As you go to the chiropractor, remember the subluxation is your adversary, not the disease, not the symptoms. When you go to the chiropractor, realize that he or she needs only to move the bone and allow it to come back into its normal position, however many times that has to be done, however long. That's between you and God. That's not between you and the chiropractor. And so, give yourself some time, understand this thing, understand the physics of it, understand the mechanics of it, and understand the seriousness of it. And let me say once again in closing, if you don't know subluxation, you don't know chiropractic, no matter how long you've been a patient.